Assalamualaikum warahmatullahi ta'ala wabarakatuh, and salam sejahtera to honorable judges and all audiences. I am Azaitun Akma Shahrin, currently doing my pre-gazettement in Melaka Tengah. I would like to present my research entitled Micro-osteoperforations Effects in Accelerating Alignment of Maxillary Anterior Crowding, a randomized controlled clinical trial. Nowadays, the demand for orthodontic treatment is increasing, and there is a long waiting list in government setting. Orthodontic treatment is a very time-consuming. It could be up to 36 months when involved extractions. This could expose patients to iatrogenic risks such as caries and gingival recession. Maxillary anterior crowding is the area that the patient concerns the most. Majority of the referrals from dentists are concerning to this area. Researchers tend to emphasize more on accelerating orthodontic tooth movement. Many modalities have been reported to accelerate tooth movement, involve invasive surgical methods, drug injection, and device assisted. All these techniques are not really accepted in routine practice due to several drawbacks. Micro-osteoperforations or MOPs is the most minimally invasive surgical procedures. It is expected to have better tolerance amongst patients. However, its clinical evidence are still deficient. RCT is a high level of evidence, and this is the first trials investigating the effects of micro-osteoperforation on the alignment rates of maxillary anterior crowding. Clinical orthodontists should demand these kinds of study before adopting any new technique. These photos shows that MOPs are the most minimally invasive surgical procedures. The first three methods have been reported to be associated with scarring and infection. In general, we aim to evaluate the effectiveness of MOP in the alleviation of anterior maxillary crowding during the first phase of orthodontic alignment with fixed appliances. Specifically, first, we aim to compare the overall time taken for the alignment of maxillary anterior crowding, and second, to evaluate the alignment improvement percentage. Sample size was calculated using this formula based on the finding by Syed Hassan. 9 participants were indicated for each group. Considering 20% of dropout rate, we included 15 participants for each group. Moving on to the research methodology, this is a prospective, randomized, single-blind, single-center to unparalleled clinical trial. We have obtained ethics approval from the UiTM Research Ethics Committee, and for the randomization, we use sequentially numbered opaque seal envelopes with block randomization of 6 to ensure an even number for both groups. For the perforation technique, MOPs were performed under local anesthesia, and 2 MOPs at 3 mm apart were performed on the alveolar bones between the upper right canine and upper left canine using this propel device. This device consists of 2 components and has a depth indicator. We are performing a 3 mm deep of perforations following the study done by Al-Hani. For the alignment improvement percentage, little irregularity index were measured on cast up to 6 months, and we use this modified formula to get the improvement percentage. Moving on to the results, this is the consult flow diagram. A total of 35 patients were eligible for this study, 5 were excluded, and 30 patients were randomized into 2 groups. 1 dropouts occurred for each group, and finally 14 participants from each group were analyzed. The first tables demonstrates the demographic characteristics of the participants. The age between groups was not statistically significant. Majority of the participants composed of Malay, female, and class 1 incisor relationship. The second table compared the median initial little irregularity index between groups, and the difference is not significant. This is the result for the first objective, maxillary alignment duration. The median overall time taken to complete alignment for MOPs and control group was 139 days and 143 days respectively. There is no significant difference in the alignment durations for both groups. The second table shows the hazard ratio for groups, and initial little irregularity index values used to describe the extent of MOPs and initial LLI values that may affect the probability of alignment. These findings suggest that only initial little irregularity index shows statistically significant with hazard ratio of 0.755. This is the result for our second objective. In overall, there is no significant difference in the mean improvement of alignment percentage between groups with the p-value of 0.124. This graph is the Kaplan-Meier curve showing the cumulative proportion of alignment not yet achieved during the follow-up time in both groups. The green color represents the control group, meanwhile the blue color represents the MOPS group. From here, we can see that MOPS group is slightly faster in the alignment duration. However, further log-rank tests reveal that the difference is not statistically significant. This photo shows the alignment changes at every monthly follow-up, and from the experimental model at 1 month and 5 month reviews, we can see here that there is no any scarring identified. Moving on to the discussion, the reason why we only included adult patients because of the alveolar bone density increases and more fibrotic PDL in adults. Besides, the younger patients had higher rate of orthodontic tooth movement, so we excluded the confounding factors. Differed from our finding, Bansal et al. Found that MOPs significantly increased the rate of mandibular alignment by 44%. Differed from us, they included adolescents with moderate little irregularity index values. Our findings are in agreement with Asad Hassan that the improvement rate decreased throughout the duration and follow-up treatment. There are two limitations with our study. First, the irregularity index used to evaluate and monitor crowding does not consider tooth position and changes in tooth dimensions. Second, the generalizability of this study may be limited by a single-centered based clinical trial. As for conclusions, based on our findings, MOPS therapy is not effective in accelerating initial orthodontic alignment and does not enhance the alignment improvement percentage. We would like to recommend first a 3D analysis of the study class assessment so that the correlation between anterior-posterior and vertical position of the teeth with alignment rate can be monitored and highlighted. Second, the effect of MOPs during orthodontic alignment are very minimal, even though it's repeatable and practical but not cost-effective. Third, future studies are needed to investigate the effects of MOPs throughout the whole comprehensive treatment durations to assess its complete effectiveness. These are my references. With that, thank you very much.